Okay, good morning or good afternoon, everyone. We're just on the cusp here. It's 12 noon. I'd like to welcome everyone to our first in the series of our webinar on the determinants of health. And today we are going to be doing financial security and health. And I want to start us off by acknowledging that I am located in Nalek I'm practicing that. That's the new name for Antigonish. Let me rephrase that. That is the centuries-old name for Antigonish that I'm learning about. But I'd like to do a land acknowledgement. We begin by begin our gathering by acknowledging that we are meeting on Mi'kma'ki, the unceded ancestral territory of the Mi'kmaq people. This land was covered by treaties of peace and friendship, first signed with the British Crown in 1725. Mi'kmaq people have been the protectors, guardians, and stewards of the land and waterways as the original peoples. We recognize and lament that the treaties have not been honored by European settlers and that the legacy of colonialism is still being experienced. We invite you to take time during our conversation today to reflect on what it means to be treaty people and on the ways that we can deepen our relationships as we walk the path of reconciliation. We hope that our time together will honor the importance of the land, the Mi'kmaq elders, and all the Mi'kmaq people who have cared for this place from time immemorial. We offer our deepest gratitude and solidarity. And I would also acknowledge the historic oppression of the African Nova Scotians that have been among us for a few hundred years, a few centuries. And as we know, when we look at the health of these different peoples, they are the ones that suffer often more significantly than others because of that oppression. So let's get started. We have a full agenda today. I would just like to introduce three of the people who have come to share their knowledge and experience with us today. Lars Osberg, Lars Osberg.
Osberg, yes.
Oh, Osberg, sorry, Lars. Is currently McCulloch Professor of Economics at Dalhousie University in Halifax, but began life in Ottawa, Ontario. As an undergraduate, he attended Queen's University, Kingston, and the London School of Economics and Political Science. After 2 years of working for the Tanzania Sisal Corporation as a CUSA volunteer, he went to Yale University for his PhD. He has had visiting positions at economics departments of New York University and the universities of Cambridge, Sydney, New South Wales, Essex, and Queensland, and at research on poverty alleviation in Dar es Salaam, the Indira Gandhi Institute for Development Research, Mumbai, and Statistics Directorate, the Organization for Economic Cooperation and Development, Paris, and the Institute for New Economics Thinking in Oxford. He has written numerous books. His first book, Economic Inequality in Canada, 1981. His 2018 book, The Age of Increasing Inequality, The Astonishing Rise of Canada's 1%, was awarded the 2019 Purvis Prize of the Canadian Economics Association. His most recent book is The Scandalous Rise of Inequality in Canada, 2024. In between, there have been 9 others, 4 editions of an introductory economics textbooks, and numerous refereed articles in professional journals, book chapters, reviews, reports, and miscellaneous publications. Among other professional responsibilities, he was president of the Canadian Economics Association from 1999 to 2000. His current research emphasizes the implications of increasing inequality and the measure and determinants of poverty, economic insecurity, inequality of opportunity, and economic well-being. We also have with us Rebecca Chafe. I hope I got that right, Rebecca, sorry, is a knowledge translation specialist at the National Collaborating Center for Determinants of Health and is the project lead of the Mind the Disruption podcast. Before joining the NCCDH in 2021, she led a range of equity-focused policy research projects and networks related to decent work, income security, and access to health and social services for 6 years at the Wellesley Institute. Rebecca has a Master's of Public Health from the University of Toronto. And we also have Christine Saunier as the director of the Canadian Centre for Policy Alternatives in Nova Scotia. She is a doctor in political science from York University. She leads the living wage calculations for communities across Canada and serves as a co-author of the annual Child and Family Poverty Report Cards of Nova Scotia, and a whole long list of other things that she does. So I would like to welcome all of you here today, and I think we're very well positioned with the questions that we have around financial security and health, that you all have a lot of experience and knowledge to share with us. And for your information, for the participants, we are going to carry on today as they were in a conversation. So I have a number of questions that I'm going to pose to our guests today, and we are going to open it up for people to also add some of their own questions or comments after each question. Now, we will have to keep track of time, so we might only have time for a couple after each question, but we'll do our best to get everybody that's aboard here to be able to participate. So without further ado, I will begin by asking the first question: what are the supportive factors and barriers to financial insecurity? And I'll just go first with Lars, second Christine, and third with Rebecca, if you don't mind.
Hey, thanks very much for the question and for the very generous introduction. I think sometimes it's useful to say obvious things right up off the top. I mean, rich people are not financially insecure, and particularly if they've inherited their money, and we don't have an inheritance tax in Canada. If you've got $1 million in the bank, that generates interest at 5% interest, that generates interest income of $50,000 a year. If you've got 10 million in the bank, that's $500,000 a year. And so you have that income every year, and you also have the peace of mind of knowing that if any emergency comes along, you can always just take a little bit of money out of the bank. And if you're born into those families, that's your life. That's your experience of normal living. So financial insecurity and the pressures and the consequences of financial insecurity are not something that happens to people at the top of the wealth distribution. It's something that happens to the other 99% of the population. And the welfare state, which the institutions of the welfare state, which were built up over the latter part of the 20th century in Canada and have been cut back enormously since then, were always primarily about giving ordinary people a taste of economic security, a taste of. They're not primarily about redistribution from the lifetime income rich to the lifetime income poor. They're about redistribution between contingencies, about what happens to you if you're sick, what happens to you if you're unemployed, what happens to you if you have an industrial accident. Those now, to look at it going forward, nobody quite knows whether they're going to be sick in the future or have an industrial accident, or we don't know those things. So those events happen to some people, the unlucky. They don't happen to other people, the lucky. But everybody gets some peace of mind if they know that there's going to be a social safety net there for them if something bad happens in the future. The costs of economic insecurity are not just the impacts on the people who actually have the bad luck to have an industrial accident or something like that. They're the peace of mind that everybody experiences who know that they won't be that badly off if something bad happens to them. So the social insurance role of the welfare state is absolutely crucial to maintaining a sense of financial security. There's also the important set of things that the Europeans call the social wage. The services that are available to people either free or at subsidized cost. The idea that you can get around with a public transit system that actually works and is dependable and fairly frequent. That's an enormous benefit. So you don't have to worry about repairing your car or some bill that comes along that destroys your finances. The more the greater the social wage, the less it matters if you've got a fluctuation in your earnings or you're laid off for a little while. And it's not, and we also really want to remember that the costs of economic insecurity are not just borne by the primary earner or the adults in the household. They're borne by everybody in the household. Some of the biggest impacts that we find in international research are on the children of people who experience a greater economic insecurity, because they have to live in a family in which their parents are under more stress, and stressed out parents kind of have to, they've less mental bandwidth, less to cope with all the problems that come up in family life. So the costs of economic insecurity are borne by the people who experience the bad events, and they're also borne by everybody in their families, and they're really significant. And
Lars,
I've
can
probably
we?
yammered on for long enough.
Yeah,
Over to
if we could
somebody else.
just let's try Christine to add to this discussion, if we may. Go ahead, Christine.
Sure. Thanks. And thanks for the invitation to be here. I mean, I'm thinking about peace of mind, as Lars said, when I think about what financial insecurity really means. And really to think about, it means that people have choice, that they have actually real options, not driven by the measly amount of money that they have, like that they can go to the grocery store and choose the things that they know are the most nutritious thing instead of the thing that's the cheapest but has more calories and will fill you up. Like that people can really have control over decisions in their lives, because on the one hand, they have enough on the finances, they have enough to afford all the essentials, but they have a little more than that. They have that cushion that Lars talks about. And then that there's that security piece, which gets at that stress piece. And what I was thinking about as Lars was talking was the way that the living wage work that we do is designed. It is designed with underlying principles that get at this financial security piece. We calculate it to first capture the budget of essential costs that are required that people need to be able to afford. But in that budget is also an education piece, because we know that part of supporting people to be able to reach their potential, say, is education. So there's a little education budget. But we also have a social inclusion budget in our calculations. And that gets at that quality of life piece. It gets at, this is not a poverty wage. It's not just bringing people to a poverty line. It's bringing them just a little bit above it, so that they can, in their own terms, be included in however they want to be included in their community, that they're not facing stigma, that, again, they're not making difficult choices. And I think about some of the work we did talking to low-wage workers, and so struck by what it would mean to them to earn a living wage. It means like being able to afford a birthday gift for their child, but it also means being able to afford a birthday gift that they can give to their child to bring to a birthday party and not be embarrassed. It means that they can invite maybe their child's friend over during a time that there might be expectations of food, which for children is often most of the day, and not being stressed about that, not being embarrassed by perhaps the quality of housing that you have. Like that social inclusion budget is supposed to kind of get us to that, as well as our household expense budget. Like we all talk about what affordable housing means. We all know what that means. What does it mean to have a basic nutritious basket? But it's also like all of the other things that add up. Um, and things that are often convenient things that those of us who are fortunate enough to have income can afford, that help on the time side, I'd say. And the living wage is based on a 35-hour work week. So I think those things go together, that we're not constantly stressed out. We have enough money and we have security because we have a cushion and we have the ability to have control over decisions and make choices. Oh,
Thank you, Christine, for bringing that together with the living wage. Makes so much sense. Rebecca, would you like to weigh in on this one?
Sure. Hi, everyone. It's great to be here. Yeah, I'm Rebecca's chef. It's like a cook.
Okay.
Yeah. Okay, so this feels like a good panel. We're all bringing something a little different, but lots of connections. So I think when I think about financial security, a big thing, if I'm stating the obvious, like Lars said, was that employment is the main income source for most people in Canada. And so low wages and precarious employment are something we really need to be thinking about. We're thinking about poverty and financial insecurity. So precarious employment encompasses low wage and not having a living wage, but also things like scheduling uncertainty, income instability, job insecurity, having involuntary part-time, casual, flexible, temporary or gig employment, lack of collective bargaining, limited worker rights, powerlessness to exercise those rights and speak up. And so when we think about for example, making a minimum wage, which doesn't meet the living wage in Nova Scotia, that's going to impact your ability to meet your material needs. But if on top of that you have a lack of guaranteed hours and your schedule is changing week over week, that's going to compound the impact of that low income. And lots of times it also comes with a lack of benefits like medication, vision, all that stuff. So that can really compound. And so precarious employment, I think, is really something we need to be thinking about. It's been increasing across the country. So unionization rates are falling, temporary work is growing, the minimum wage isn't keeping pace with the cost of living. And I think another point that's important is that these conditions are intentional and they're modifiable through public policies like the Nova Scotia Labor Standards Code and through worker organizing. So I'll leave it at that.
Thank you so much, Rebecca. That was very helpful looking at those various aspects of the wage and decent work. We have a few minutes if we'd like to open it up if anyone has any comments or questions. I don't see everybody here, so I don't see hands up. Okay. Does anyone have any comment that they want to make at this point around the question of the supportive factors for financial security or the barriers that we have just talked about?
I don't know. Sorry, Sean. Go ahead, Sean.
My apologies. I wanted to mention, we do some local stuff here in Dartmouth. One of the things we're working on right now is a winter coat drive. We find people in the community. Right now, we're looking at a lot of homeless people and children. We find coats for they need coats. We raise money for it. It's been something that's been going on for several years. One thing we're finding now is that we have more people in need and less people able to give, as we find the financial security of people is, well, going downhill. And you may imagine winter coats, great. You keep your torso warm. It helps you keep you heated, keep you healthy when you're outside in the winter. But then if you think about being a kid going to school in the winter or being outside during recess and your feet get wet and cold because you've got a great winter coat, we go to winter boots. And there's not enough to go around anymore. So if there's any thoughts on how this is affecting people, we look at our children, we see what's going on with them. And it's cold for them. So that's my thought, is that we're leaving our children cold and outside.
Thank you, Sean. That is that is very important and helpful what you're contributing there. Was it Robert? Did you want to? I'm not sure if you wanted to say something. Okay, and I just see here Lucille Harper in the chat who says we've always have to be conscious of applying the rural lens, especially around services such as access to hospitals, healthcare, public transit, and that is so important to keep in mind. So I think we'll move on for the sake of time to our next. Sorry.
Sorry to cut you off there. I just noticed there was another question in the group chat from Michelle Ferris.
And that is what?
I can
So
read
it's
it
just
now.
about the living wage. I'll respond. I was going to respond in the chat, but you can have a look at our report. Yeah, if the living wage is calculated for one individual, it uses a reference household in order to get to the one wage amount. So if you're a single, you would be earning the amount for one person. And we have regional wage weights in order to capture rural differences versus some of the more urban areas in our province. So yes, and I can give those, but maybe I'll find the report and I'll put it in the chat for people.
So good.
Robert, are you saying something there? I'm not sure. Okay. Okay, so let us move on to our next question, which was already started to, people started to talk about, but there is so much to talk about this. Like, in what ways does financial insecurity impact one's overall well-being and the ability to engage in meaningful interactions and community well-being? So how is that affecting us? And I'll start with Christine this time, go to Rebecca, and then to Lars.
Thanks, Helene. Yeah, I think I sort of went there in the first question, which was really trying to get at the stress that comes from financial insecurity. And of course, the impact that has on our health in all its forms, physical, mental, emotional health, when we're under tremendous amount of stress because we don't know whether we can afford rent this month and we're not sure how we're going to stretch our grocery bill one more time, and oh, there's something else that we have to pay for, and oh, the car broke. And so it's, you know, being under chronic stress like that, the flight and fight all the time really does take a toll on the body. And of course it's all of the other things that we can think about when we think about not having enough income in order to afford quality housing. So housing that perhaps doesn't have, you know, mold that you're having to deal with, that you can afford the heat in your house, that all of the things that you need in order to just have what makes you healthy. And then of course, what's compelling about the research on the impact is it is a relationship that goes both ways. Your health can impact whether or not you have financial insecurity, but of course you can be financially insecure or not, depending on the other. So in other words, you know, the health gradient, your health outcomes improve based on your health status. And we have so much research that is compelling, that shows that is the case as far up the ladder as you can go, with the research on civil servants in the UK and then the United States that show like there's a difference between the deputy minister and the whoever be below them. They all make decent wages, but actually it's not the deputy minister that's under the stress that's giving them a heart condition. It's actually the further you go down. So speaking to what Rebecca brought up, and Lars as well, about the precarity of not being able to have control over decisions in your workplace, over decisions in your life, not having enough wealth or income or education credentials being recognized, all of that allows us to really be able to engage meaningfully. As I think I also said in my first answer, like if you're under that stress, you have anxiety, you might have depression, all of that impacts your relationships, and really whether or not you might even self-isolate. I mean, Lucille talked about rural. It is much harder in rural because of the cost of transportation. Can you afford to leave your house? Can you get access to internet? Can you afford a cell phone? All the things that allow you to be able to engage meaningfully. Look, here we are on Zoom. There are certainly people who wouldn't be able to because they don't have the computer. So I think it's really thinking about how that social, if we don't have that social safety net, we're not supporting people to reach their potential, and we're not ensuring that people can leave their homes when they want to, live in a home that's healthy. All of that comes together to impact their well-being, and we lose as a community when people can't engage in the ways that we need to. You know, we lose every time. And I'll just say this last thing, you know, we costed poverty a few years ago, and actually we quoted Lars in the very first report we did that said we shouldn't have to cost poverty. I can't remember your quote, Lars, but it was like, it's a basic human right. Why do we even have to make a case for it? We should just not have people living in poverty because they have a right to get access to what they need. But why we did that is because we need to underline that this is about community, that this is a shared economic cost for all of us. And that's not, we didn't include the cost of social assistance. This isn't that people living in poverty cost us. It's that we lose out because people are having to use the healthcare system more because of the impact of all of this. So,
Thank you again, Christine. Rebecca, do you want to jump in on this one?
Sure. Yeah. So I work for the National Collaborating Center for Determinants of Health. So if I love this series, and if anyone's interested in, we have all sorts of resources about how things like employment, different parts of our life impact our health. So I'd encourage you to check out our website. But a couple of years ago, my coworker and I were asking the question, how does work impact health? And we did a big review of the literature. And it's really clear that work is a powerful condition of our everyday life that can harm our health, or on the flip side, it can promote health of workers, families, and communities, which Christine and Lars have talked a lot about, right? Not just the impacts on the individual, but their family and community. And so some of those health impacts are really obvious and common sense, like the way that minimum wage doesn't cover the cost of food, it drives food insecurity, it's not enough to cover rent. So those basic needs, right? Getting a coat, right? Like Sean was talking about. There's other ways like lack of guaranteed hours that can really reduce workers' ability to spend time with their family, their children, to volunteer, to do things that help build social connection. And then there's some really hidden ways that precarious work and kind of having temporary or contract low wage jobs can impact health. So, for example, workers who don't have strong worker rights are 5 times more likely to have a physical injury at work. So some of those are things that we might not be able to see quite as clearly, but yeah, when people are in those precarious positions at work, it can impact their health in all sorts of ways. And I think if we kind of recognize precarious employment and inequality as the problem, we can see decent work as part of the solution. And I think that's what gives me a lot of hope, is that this goal of dignified and healthy working conditions for all workers is something that people are really mobilizing around the world and across Canada. And that includes, you know, secure permanent jobs, wages, hours, benefits, strong rights for all workers. And we know that those strong rights for workers are really important. They kind of lift all of us up, and they're really important for non-unionized workers who don't have the same bargaining rights. So it really creates a strong floor that we all benefit from.
Wonderful. Thank you so much for that aspect. Lars, would you like to elaborate or expand on some of these things around?
Yeah, I'd like to pick up on what Christine was saying about the health implications of chronic stress, and how chronic stress is what you experience when there isn't much of a social safety net, and when the job structure is moving to more gig employment and on-call employment, and just very undependable income sources. And just to there's been a lot of research on the health implications, and so just to focus on one of the implications, and that is the impact on obesity, because there's a great phrase out there: comfort foods, what you eat when you're stressed out, right? And in relatively rich societies, where there's enough income to have cheap sources of calories available, what you observe is that when people are stressed out, they kind of self-medicate by eating a lot of comfort foods. And so the obesity rate is highest among lower income people than among higher income people, because lower income people are much more exposed to the insecurity and the stress that comes with a world without social safety nets. And we have evidence from Canada. I mean, it's 30 years ago in Canada that we renamed unemployment insurance employment insurance and cut it dramatically. And so it used to be that like 80% plus of the unemployed were able to get UI benefits, and now it's well under 40%, last year 37%. So we really just don't have a social safety net of any kind for people who become unemployed. And it just so happened that just before that reform happened in the early 90s, there was a survey that surveyed people and took their weight and their height and all that sort of stuff, and surveyed them after the reform as UI became EI. And what you observed was a big increase in the obesity rate. Not just of the people who became unemployed, but of the people who were more exposed to the risk, which now they couldn't get EI benefits to protect them from of unemployment. And that sort of evidence, it comes from around the world. China used to have a system, they called it the Iron Rice Bowl, where you had lifetime employment. The biggest shock in the world, like 30 million people lost their jobs, 66 million people kept their jobs, but obesity rates skyrocketed. So the impact of the lack of a social safety net on measurable health outcomes is just clearly established in the research literature. And of course, it's not just the people who get the illness or get a mental or physical illness, it's also the rest of us who bear the cost of that.
Wonderful. Thank you so much, Lars. One of the things that comes to mind for me as the implications is the stigma that's associated with poverty and the criminalization of poverty, getting arrested because you're living on the streets. We have this real mentality and culture of poor people are bad people or criminals or all kinds of things. So along with the stress, you also have this discrimination that goes on, which just further complicates things. Do we have anyone that wants to jump in with some comments of their own? I see we have Tara Webb has said we have a social safety net, but it isn't keeping many people from hitting the ground. Income insistence, EI, that sort of thing. Thank you. Anyone else that wants to weigh in on this for the moment? Tara, you have your hand up. Are you wanted to say something?
Yeah. I think I think of my experience when I was doing my social work degree, and funding or my student loan didn't come through right away, and I spent some time in pretty dire need. And I think, just kind of echoing the data with my own personal experience, I knew that poverty and not having enough to eat and not knowing how you were going to maintain housing was stressful. What I didn't know is that it sucks every ounce of positive coping out of your body. And I remember walking down the street at one point and thinking to myself, oh, so this is why people smoke. And, you know, I've never smoked, and I didn't smoke at that time, but mainly because I don't think my lungs can take it. But I mean, all of a sudden, it just suddenly made so much sense to me. And I think just to kind of build on what other people were saying as well, in terms of employment, a lot, you know, people, you know, I've seen people trapped in really bad, abusive, dangerous jobs because they were afraid of ending up without job. And, you know, it gives employers without positive intent an awful lot of control over people, and that increases the injury rate. But yeah, just to kind of follow that.
Thank you, Tara. Sean, you have your hand up there.
One thing that I've heard recently was that someone said people often forget that those who are in need of assistance are burdens on society. The vulnerable in societies is where the societies were formed around, to raise those people up and make them more productive members of the society. As a person with multiple disabilities and someone who works in the disability community, I gotta say, given a chance, most people with disabilities turn out to be excellent workers. With the assistive devices we have nowadays, we could do so much. But if you're on a pension for disabilities, if you're on a disability insurance, or if you're on income assistance, often there are barriers put in place around that that prevent you from going forward to gain the training and abilities to find a new position, to help grow your place in society and to help society grow with you. We need to find a way to help people become more without making them afraid that they're going to be less.
That's an excellent point, Sean. Thank you so much for bringing that up. It's so true. I just want to read what Lucille put in the chat here. We know that poverty is policy created and policy enforced. Our economy is based on paying low wages for as many as possible, and then people are blamed for being poor. I'm concerned that the blame for some of our social failures are being blamed increasingly upon immigrants and temporary foreign workers. And absolutely right. We're hearing this a lot. Our housing crisis, we have to stop taking in more immigrants because we have a housing crisis. And the Antigonish Affordable Housing Society was first created in 1993. Long before we had an influx of immigrants. So this has been an issue ever since the government stopped funding public housing in the 70s and 80s, or around that time. Okay, I'll move on to the next question. And I think we'll start with Rebecca, and then Lars, and then Christine. And so what we're talking about now is how can we further opportunities for change? What is that need to, what should we be changing, and how can we do that? Rebecca.
Sure. So I'll talk about decent work. Surprise, surprise.
No, that's good.
That's my perspective for the day. Yeah. But I think kind of the first part there is that any kind of policy, social change, it comes from building our collective power and worker power. And so I think we should be thinking about that in any strategy we do, right? This change can't come from individuals. These problems aren't individual problems. We've talked a lot about that stigma and blame of individuals, but these are intentional structural problems. And so we need to come together to address them and call for employment legislation, improvements, and kind of the future we want to see, right? And change some of those social norms. And I think part of that that's really important is centering low income, disabled, migrant, queer, women, Black, Indigenous, other racialized workers who are disproportionately harmed by some of these low wages and precarious employment because of the way that discrimination weaves its way through our labor market. But I think if we think of different like opportunities to kind of build worker power, if you work in a program or at a community space, there's ways that you can kind of, in addition to offering a service, use your space or that time to be bringing clients or people in the community together to build their power. And so sometimes people host, know your rights workshops, things like that, or they bring in worker organizers. And so it's a way of connecting people. There's an example from Toronto where staff at a health center, so the Parkdale Queen West Community Health Center, were seeing nail technicians coming in with really similar respiratory and skin conditions. They could have just met their health needs and provided some medical care, but they started, their health promotion team started talking to nail technicians and doing a roundtable and focus groups and identifying needs. And what they ended up doing is hiring a paid peer organizer and bringing together a network of nail techs to learn together, to kind of share their struggles and to collectively advocate for changes to some of the chemical regulations, the employment standards, and some of the ways that migrants' rights are restricted. So that's kind of an example of how they didn't just provide care, but they also focused on power, right? And the power of workers.
Wonderful, excellent example there of empowerment. Thank you, Rebecca. Lars, would you like to say something here?
I think we've been talking quite a bit around the idea that individuals can save up a little nest egg to try and make themselves safe, but that's not really a feasible strategy if you're on a low income to start with. Individuals can try to buy insurance in the private market to get some peace of mind, but that's only feasible for if you happen to like own a house and you want to protect it from the fire. If you're really talking about most people, there really is no substitute for social insurance, for the idea of the pooling of risks in a community. That I mean, and it's based on the idea that well, we live in a world which is changing all the time, which is throwing new risks at us all the time, and 99% of us don't have the money to just self-insure against those risks. So it's really a collective choice how much insecurity gets borne by the 99% of the population, and it's the solution to collective problem. It has to be collective action, largely political, or organizing at the individual workplace is part of the thing, but basically it has to be a collective response, which makes life better for the 99% or the 99.5% who just can't depend on their wealth to keep them safe.
Thank you, Lars. Very good points. Christine, would you like to weigh in on this?
I agree with my panelists, co-panelists. It is systems and structures. I had written down some notes, but I think, for me, when I look at what are the further opportunities for change, I'm actually going to say it's climate change. It's that we as a society have to do things differently because we are killing our environment, and we have piles and piles of evidence to show that. And I'm going to connect it back to financial insecurity in that, we are now talking about this idea of a care economy, like that we need to be shifting towards something that provides the decent work that Rebecca is talking about, but that we recognize both sides of that equation. Again, I'll just think about the living wage work, where we talk about the income and the working wage, but we also talk about what is government bringing to the table, where are the income supports, the tax credits that recognize that a consumption tax is regressive, and we want to support people, that we also look at how we support people so they don't have to pay so much out of pocket for the essentials, as Lars is getting at, right? So public health care, we're finally getting a little sense of pharmacare and dental care, but we can do obviously much more in terms of access to healthcare. But if we just, like, I think it is an opportunity to try and value work that has been undervalued, that often is performed by women and racialized minorities, and often people who don't have permanent status, like that we can begin well past the time that we should be really thinking about changing how we approach work and how we approach the economy. We published a report, I don't even know when, a few months ago, that looked at the percentage of people who earn $20 or less an hour in Nova Scotia, well, in the Atlantic, but in Nova Scotia, that's 35% of our workforce. I mean, and when you look at what those jobs are, we know what those jobs are. They're undervalued jobs that we just, as a society, have not placed enough value on that work that really is about, like, taking care of each other. It's the childcare. It's all of the things that we know that we now need to be valuing more, because they're often also the greener options. And so I think it's an opportunity to be connecting the dots, and those dots need to be connected in ways that make sure that we are being more inclusive than we have in the past. Looking at who has the higher poverty rates in our society. Again, that's new immigrants, it's refugees, it's people with disabilities, it is about discrimination, it's racialized groups, and we can do much more. I mean, I've looked at the research on people with disabilities and attachment to the labor force, and it is striking to those who don't know and haven't given the opportunities, haven't even looked at what accommodation would look like, often wouldn't even cost much, but employers just haven't had the disincentives to not go there, or the incentives to go there. And that is, people with disabilities have such loyalty they bring to the workforce because of the things that Sean, I think, was trying to get at, right? If we give people opportunities, and they're fair opportunities in those decent working conditions that are meaningfully contributing to a better, just world, wow. Okay, that sounded like a bunch of gobbledygook, but I really do believe that is the way forward.
You're absolutely right, Christine. It's not gobbledygook. It's very important. And I think what we're hearing here is the values, what we value, what we do not value. And it's part of the mentality and the culture. Why do we have people making policies to keep people in poverty, or have policies to take back money from them, and disincentives? And one of the things the former Prime Minister of New Zealand said during COVID, she said, I hope now people will realize we live in a society and not in an economy. And we're really caught up. We value what people can contribute to the economy. And of course, men contribute more. They have higher paying jobs. People with disabilities don't contribute. Women don't contribute. Seniors don't contribute. And and if you work at a grocery store as a cashier, you're only contributing a little bit. So you're not very much valued. And it's really how we value all kinds of work. And if we made decisions based on how it's going to contribute to our society, then we wouldn't have any unsung heroes. Everyone has something to contribute to society all the time. But if we only consider it as an economy, then we're very limited in who we value and who we don't value. So I'm going to stop there and go on to, Lars, and then I have Roger with his hand up. Go ahead, Lars.
If I could just jump in. I mean, one of the fascinating things about the economics is that you can always look at anything from two sides. And one of the things that I would like people to take away from this seminar is that when you hear see a news report about labor shortages and what a terrible thing they are, that's seeing it entirely from the point of view of the employer. A labor market shortage is a worker's best friend, and particularly a disabled worker's best friend, and particularly marginalized workers and discriminated against workers' best friend, because a labor shortage firms they're going to lose sales if they don't get the work done. So they have an incentive suddenly to hire that person that they weren't going to hire because they didn't want to take a chance on them, to make an adaptation at their workplace so that a person with a disability can actually do the job, to maybe intervene and arrange childcare for somebody who couldn't take that job if they didn't have childcare. So labor shortages are absolutely a worker's best friend, and particularly a disadvantaged worker's best friend. And so when you see people talking in the news media about what a terrible thing a labor shortage is, that's entirely seeing it from the point of view of the employer. And we do want to see it from the point of view, sometimes at least, of the other 99% of the population.
Thank you so much. Good points there, Lars. Roger, you
Also,
oh,
it's not that people contribute more, they're paid more.
yes, exactly. Sorry, Roger, go ahead.
No, that's great. Thank you, Colleen. Thank you for the opportunity. I've been enjoying the conversation. The elephant in the room for me is basic income guarantee. I really appreciate the conversation about work. I'm all into work. I support work. I don't believe in a right to work, but yes, everybody that I know, i.e. an adult, should go to work every day. I agree with that. But basic income guarantee, I think, needs to be talked about. I could go on at great length, but I won't, Colleen, so I'll warn you, I'm going to cut it short. But I do want to make a couple of points, and I'm really curious to hear what Lars might have to say about this. Since 2019, Warren Buffett has been saying that we need some combination of minimum wage and a negative income tax. I believe that we need a basic income guarantee. Nova Scotia and Canada are in a unique position because we're proving it all the time that a basic income guarantee will work. Old age security, I forget the stats, before old age security, guaranteed income supplement, senior poverty in Canada was like 70%. It was some crazy high figure. And now senior poverty in Canada hovers around 6%. And we're even smart enough to realize, we got to help them out a little bit more. So we're going to help you with your teeth and things like that. We give people child allowance for children. I remember my first baby bonus was $34 when I had my first kid. Now people are getting $600. And I know families with 3 and 4 children, and it's still not enough money. But at least we're showing that we want to move in the right direction with children, and demonstrating that a basic income for children will be helpful. Justin brought in the Canada Worker Benefit. God bless them. It's $1,400 a year for people like my daughter that earn less than $33,000. It should be $1,400 a month, but we can argue that one as well. But again, the principle is there. The Canada Disability Benefit, $200. Oh my God, I almost pulled what little hair I had left out of my head. $200. But again, at least Newfoundland understands that they have to throw more money in the pot, and it's going to be $600 in Newfoundland. That's a good thing. The idea that we need a basic income, I think, is being proven every day. The problem is we don't agree that everybody deserves it. So that's a policy thing that really irritates me. Almost like they want to pick and choose. We'll pick the ones that should get it, and the other ones, they're on their own. We need to unite and have a strong voice saying, if you're a citizen in Nova Scotia and in Canada, you deserve a floor, and we won't let you fall below that floor. Or someone said a net with smaller holes would be a really good thing. And the last thought is about changing work. I firmly believe the capitalists are going to drive us all into the ground. God bless them. They're trying to make a buck. They're trying to keep their businesses going. If they need the precarious workforce that is obviously increasing, and Rebecca, you're right, it's around 30%. It's only going to get worse and worse and worse. I'd love to see more worker benefits, more organization, more unionization. But let's say that ship is really tough. And, you know, when we green the economy, people are going to be losing jobs. When AI takes the 10 or 20% of jobs away from Canadians and Nova Scotians, you know, we need to put something in place so that, yes, you can go to work. And if you can make $15, $20, $30, God bless you, go to work. You should be going to work. But we're going to top that up so that you're not the working poor. And that's going to be the change. The change is not welfare reform. The change is the fact that we're all going to work and we can't make enough money. So if you increase, if you have a basic income guarantee, then all of those things will go away to a greater extent, and we can move on. Thank you for the opportunity, Colleen. I'm interested to hear what the panel might have to say about a basic income guarantee.
Okay, well, thank you so much, Roger. I won't weigh in on that because I'm 100% with you on that. But our last question brings us to the same thing that you're doing is what are your calls for action that you would see? And Roger certainly put out a call for action with the basic income guarantee. So we'll start with Lars and then we'll go to Christine and then Rebecca about things that you see that we need to move ahead on, actions.
Well, the first top of my agenda would be a fundamental reform to what we now call employment insurance, which everybody else in the world would call unemployment insurance. Some security for adults who are in the labor force in the event of the loss of their job. Now, as the previous caller was talking about, if we talk about a basic income guarantee, we have the OAS guaranteed income supplement system, which is kind of an approximation of a basic income guarantee for people over 65. There's the Canada Child Benefit, which is a big help for children. The big gap there is for people between the ages of 18 and 65, that vast majority of the population who face this world of insecurity and increasing insecurity. Artificial intelligence is coming down the pike, going to affect a lot more jobs than robots have affected over the last 10, 15 years. And so this insecurity thing is not going away. It's going to get bigger. And we don't have a social safety net worthy of the name for most people. So I think a big reform of the what is now called the EI is just got to be top of the agenda. And I think we also have to always keep pushing on what the Europeans call the social wage. Those are the services that everybody gets because they're citizens of the country. I mean, the living wage it can be lower when childcare costs are not as high. The living wage can be lower when bus fares don't cost as much. So the basic level of services that are provided to all citizens, I mean, one of the things it does, it maximizes political support for the agenda because lots of people benefit from these decisions of government, and they see the benefits in their own lives, not just the people who directly receive them at that point in time.
Thank you very much, Lars. Christine, would you like to speak now?
I mean, I think maybe I'll jump off from what Lars just said about sort of building that solidarity piece, because I think it's essential. And I see some discussion in the chat about how there's so much that's about dividing us and blaming really the wrong people. I'm not going to suggest that we blame the right people, but that we understand what is to blame. And you know why we are in the place that we are, and it isn't because we've finally grown our population, which is not in and of itself a bad thing. It's not a bad thing that we're welcoming migrants, that we have workers who are doing work that many Nova Scotians are not willing to do or not being accommodated to do, or whatever the reasons are. You know, I think it's about us, once again, connecting the dots and understanding that we do need to take some things out of the market because that speaks to what Lars said about public services. Like housing obviously is an obvious one. We can't just rely on increasing supply, because at some point the developer will realize that they're not going to get that return on their investment, because wait, oh, we've actually have more vacant units, and we can't just keep gouging people. That we actually need to recognize that the not, you know, successive governments, federal and provincial, drop the ball on non-market housing, public, social, cooperative housing that should have been built on the thousands every year for the last 40 and was not. And now here we are, and the kind of investments that we're hearing about is throwing more and more at developers for-profit housing that will actually likely not reach the people who are on income assistance because their incomes are so low. And that's the other piece. For me, it's building solidarity and really talking to your neighbors and your coworkers and your whoever about the misconceptions and myths that are still out there, whether about who's living in poverty and how one comes to be living in a tent, or who is and what is to blame for the state that we're in, whether that's price inflation, whether that's the lack of affordable housing, whether that's the privatization that has undermined our healthcare. And then we just say, well, we'll just give it to the private sector and they'll fix it. Like all of that has been, in many ways, just obscuring what the real problems are. And they win every time we turn on each other and don't really try and make sure that our solutions and our call to action is that we build that solidarity together by you know, thinking about taxes as the way to support building that the public services and public infrastructure that we all need in a progressive, fair way. The redistribution of wealth and income and all of that goes together for us to continue to build, right? Like we're talking about a cut to the HST. It's $371 million. You know, like that's a lot of money that we could be figuring out what to do with that might help people who really need it more. We have mechanisms easily. Governments don't need an excuse that they, you know, won't go to the basic income. I mean, put money in the affordable living tax credit, increase the income assistance as much as we need to reform it. Like we have ways. Governments don't have excuses. It is about the will, but it is that they're able to divide us and really shift the blame away from what they need to be taking responsibility for.
Excellent. Yes, absolutely. Rebecca, let's hear from you.
Yeah. I think I have two main things. So I think one would be to like find your worker organizers. So the groups of people that are working together, building solidarity, like Christine was saying, people like Justice for Workers Nova Scotia, Leah put in the chat, the Center for Migrant Workers' Rights Nova Scotia. But there's lots of people organizing, and I think going to meetings can be a way of learning, and learning what they're doing, learning what their priorities are, seeing where, you know, your gifts where you can contribute your gifts. And I met my cousins today, and we were just chatting this morning because we heard about the potential postal worker strike, and we're talking about how postal workers were really important in the struggle for parental leave. And so I think we can think about our history in the way that all the rights we have and the programs we're proud of came from struggle and from people coming together. Oh, great, Christine, I see you added Halifax Workers Action Center. That's a great other group. I think the one other thing is thinking about narratives. We talk a lot about transformative narratives where I work. And I think a lot of that's been coming through, and like talk about our values, right? So when we have these narratives about how, you know, it's just about hard work and that's all you need to get ahead, that really can mean that it doesn't matter how many facts you have, like those are pretty powerful narratives. And I think there's ways in our everyday life with our friends and family and our workplaces, we can be presenting alternative narratives to that, right? About the way we're interconnected and interdependent, and how everyone deserves a job where they're safe and they're valued and they make what they need to support themselves and their families. So I would say that narrative is an important part of making social and policy change.
Excellent. Yeah, I think it's so important. I really like that concept of narrative. I'm a firm believer in telling stories and learning from that. And I think back to COVID and what a great story COVID was. It just hit us in the face. Stay the Blazes home. And oh my gosh, there's people with no homes. You know, suddenly now we're talking about affordable housing. There is no affordable housing. Well, the crisis just opened that up, and people saw others living on the streets that they had never seen before. Unfortunately, a lot of people are suffering because of that. And then we also had the CERB payments, which when that was instituted, it was at $2,000 a month. The poverty rates dropped significantly. So in some ways, you know, we should have learned from that. But I agree 100%. We have to work together to bring about change. My concern sometimes is I find governments are downloading so much onto communities and volunteer organizations that you just get so stretched out. I see that myself with the affordable housing. I mean, this is something the government should be doing. And if they want the community to do it, they should make it easier for the community to do it. I mean, not have to fight for 2 years to get a piece of land from the province that says they're going to give everybody some land. You know, it's those things that are very frustrating. Okay, so I'm not going to go on like that. I'm going to open this up now to the group for comments, particularly what are people actually doing now? What actions are you taking, or what actions do you think we should be taking to change and to have more financial security, which brings us better health? So. Anybody?
Housing. We all talk about housing. It's a big deal.
Yep.
I'm going to ask that we have maybe an economist or somebody check my numbers, but somebody told me recently that in our federal budget, what we look at for our GDP, or whatever it's called, we see 16% of that is made up of real estate trust stuff, and another 10% of the banks who hold our mortgage. So 26% of our federal economy, GDP, budget, whatever you want to call it, is related around housing. How do we get them to lower that enough that it becomes a thing where they're not going to say we're losing money if we make housing cheap? Because right now they say we're growing the GDP, but our GDP per capita is not growing, and our people are losing their homes. And they do a little bit of housing, and God love it, we'll take whatever we can get, but we need more. So how do we convince them to do more for housing when if they show that they're losing money, they might not be elected again and they lose their jobs? And that's where they face some insecurity. So we have to try to find the solutions for them that keeps their job, or find the people brave enough that they can take that risk.
Okay. Does anyone want to respond to Sean's comments? I know the struggles you're talking about, Sean.
One of the Organization for Economic Cooperation and Development, the OECD, has a great website with a lot of statistics that you can analyze things like housing and compare Canada with a whole bunch of other countries. And if you do that, you find that Canada is quite distinctive in the very low percentage of housing that's public sector. Most rich countries have figured out long ago that the market just doesn't do low-income housing very well at all. And for a long time, Canada actually did a lot more public housing than it does now and has done for the last 30 years. And for a long time, we didn't observe in Canada tent encampments around the country. So there really isn't a substitute for a big public sector role in housing, in the supply of affordable housing. And it's kind of remarkable how ideological the debate on housing has become. Somehow it's nobody actually talks about, you know, this failure of the private sector to provide adequate housing for all of the people. And if the private sector isn't doing the job, why doesn't the public sector do it? That we used to have a more pragmatic political culture in Canada, where if the private sector wasn't doing the job, the public sector did the job. And so we built a lot of public housing in the past, and that kind of solved the problem for many people. It wasn't ideal kind of housing, could be improved, but until we get back to that more pragmatic mindset, because right now everybody seems to want to whistle around the problem. I mean, it's got to be co-ops, it's got to be the third sector, it's got to be this, it's got to be that. It can't be. You can't just go in there and build the houses. But that's the way most countries in the world actually do it, and the private sector just doesn't supply enough low-cost housing to low-income people.
I agree 100%, Lars. They should be into that. And I keep saying that all the time. There should be more public housing. You know, we're talking about all this money now into housing that the government wants to give out very, very, very reluctantly or slowly. But, you know, they're not talking about the number of new public housing that they're talking about is just a couple of thousand or something. And it's just so minimal of what is the need here. We really need that for sure. All right, other ideas. Anybody have anything else they want to bring up? There's some interesting things in the chat here, and podcast about people across Canada disrupting the status quo for a healthier, more just world. Mind the Disruption podcast. There's a couple of episodes about employment income, as well as a couple stories from Nova Scotia. Thank you. That's from Rebecca. That is excellent. Thank you very much, Rebecca.